Hello, how are you? Back again with our channel, hope you are always healthy. This story is fiction only. If there are simultaneous character names, events, or stories, that is a compatibility, except this video is an original video. We add the story with our own imagination with the purpose to provide information and education for us all. Let's get started. For paraplegic women, exercising and transferring safely can be an important part of maintaining overall health and mobility. Here are some considerations and exercises that can be beneficial. 1. Safety first. Before starting any exercise program, it's crucial to consult with a healthcare professional or a physical therapist who can provide personalized guidance based on your specific needs and abilities. They can help you develop an exercise plan tailored to your condition. 2. Transfer techniques. Transferring from a wheelchair to exercise equipment or the floor requires proper technique and assistance if needed. Some common transfer techniques for paraplegic individuals include sliding board transfers, standing pivots, or using assistive devices like transfer boards or lifts. A physical therapist can teach you the most suitable transfer techniques for your situation. 3. Strength training. Strength exercises help maintain muscle mass, improve bone density, and increase overall strength. Focus on exercises that target the upper body, including the arms, shoulders, chest, and back. Examples of strength exercises for paraplegic women include seated dumbbell presses, chest presses, bicep curls, tricep extensions, and seated rows. 4. Cardiovascular exercises. Cardiovascular exercises are important for cardiovascular health and endurance. For paraplegic women, options include wheelchair-based activities such as wheelchair racing, wheelchair basketball, wheelchair tennis, or hand cycling. Depending on your level of mobility and fitness, you can also perform activities like arm ergometry, where you use a specialized machine to exercise your arms. 5. Core exercises. Strengthening the core muscles is essential for stability and balance. Seated exercises that engage the abdominal muscles, such as seated crunches or seated leg lifts, can be beneficial. Pilates and yoga adapted for seated or modified positions are also effective for core strengthening. 6. Stretching and flexibility. Regular stretching helps improve flexibility, maintain range of motion, and prevent muscle tightness. Focus on stretching the major muscle groups, including the hamstrings, quadriceps, hip flexors, and shoulders. Gentle stretching exercises can be performed either in a seated position or while lying on your back. Remember, it's important to listen to your body and progress gradually. Start with exercises that are appropriate for your current fitness level and gradually increase intensity or duration as tolerated. Regular physical activity and exercise can have numerous benefits, including improved strength, cardiovascular health, mood, and overall well-being. Transferring from a bed to a wheelchair can be a challenging task, but with proper technique and assistance, it can be done safely. Here is a step-by-step guide for a bed to wheelchair transfer. 1. Prepare the wheelchair. Ensure that the wheelchair is positioned close to the bed on the side you plan to transfer. Lock the wheelchair brakes to prevent it from moving during the transfer. 2. Clear the space. Remove any obstacles or items that might hinder the transfer, such as pillows, blankets, or loose clothing. 3. Position the bed. Lower the bed to a comfortable height. This will depend on the height of the wheelchair and the abilities of the person being transferred. Ideally, the transfer should occur at a height where both the bed and wheelchair are relatively level. 4. Communication. If you are assisting someone with the transfer, communicate with them throughout the process to ensure their comfort and safety. Discuss the transfer plan and any specific needs they may have. 5. Assistive devices. Determine if any assistive devices, such as a transfer board or a gait belt, will be necessary for a safe transfer. These tools can provide stability and support during the transfer. 6. Positioning. Help the person being transferred to sit up at the edge of the bed, with their feet flat on the floor. If needed, use a gait belt around their waist to provide additional support. 7. Pivot or slide. Depending on the individual's ability and strength, you can use one of two methods for the transfer. Pivot transfer. In this method, the person being transferred keeps their feet on the floor while holding onto your shoulders or forearms. On your count, both of you pivot together, allowing the person to sit down in the wheelchair. Slide transfer. For individuals with limited mobility, you can use a transfer board to slide them from the bed to the wheelchair. Place the board under their hips, and with your assistance, slide them across onto the wheelchair seat. 8. Adjustments. Once the person is seated in the wheelchair, ensure that their feet are properly positioned on the footrests or footplates. Make any necessary adjustments to the wheelchair's position or accessories for their comfort and safety. 9. Double check. Take a moment to double check that the person is secure and comfortable in the wheelchair. Ensure that all safety devices, such as seat belts, are properly fastened. Always prioritize safety during transfers, and if you have any concerns about performing the transfer, consider seeking assistance from a healthcare professional or a trained caregiver. Being paraplegic waist down refers to the condition in which a person experiences paralysis or loss of function in both legs and possibly the lower part of the body, typically as a result of a spinal cord injury. Paraplegia can occur due to various causes, such as traumatic injuries, diseases, or congenital conditions affecting the spinal cord or nerves. Individuals with paraplegia often have limited or no sensation, movement, or control below the level of injury. The extent of disability can vary depending on the level and severity of the spinal cord injury. Paraplegics typically use mobility aids such as wheelchairs to move around and perform daily activities. Living with paraplegia can present significant challenges, both physically and emotionally. However, advancements in medical technology, rehabilitation, and assistive devices have greatly improved the quality of life for individuals with spinal cord injuries. Rehabilitation programs often focus on maximizing independence, mobility, and overall well-being through physical therapy, occupational therapy, and psychological support. Assistive devices like wheelchairs, braces, and crutches help with mobility, while adaptive equipment and modifications in the living environment can enhance independence. Additionally, ongoing medical care, specialized healthcare professionals, and support networks are essential for managing the physical and emotional aspects of life as a paraplegic. A paraplegic is someone who experiences paralysis or loss of function in the lower half of their body, typically from the waist down. Transferring a paraplegic from one location to another typically requires the use of specialized equipment and techniques to ensure their safety and comfort. Here are some common methods used for transferring a paraplegic individual. 1. Sliding board transfer. This is a technique where a sturdy board, often referred to as a transfer board or sliding board, is used to facilitate the transfer. The board is placed under the individual and allows them to slide from one surface to another, such as from a wheelchair to a bed or a car seat. 2. Stand assist transfer. In this method, a standing frame or a transfer aid, such as a standing lift, is used to help the paraplegic person stand up. With assistance from caregivers or using support bars, the individual can be moved from one surface to another while partially weight-bearing. 3. Hoyer lift transfer. A Hoyer lift, also known as a patient lift or hydraulic lift, is a mechanical device commonly used to transfer individuals with limited mobility. The lift consists of a frame and a sling that supports the person during the transfer. The sling is attached to the lift, which uses hydraulic power to raise or lower the person safely. 4. Wheelchair-to-wheelchair transfer. When transferring between two wheelchairs, the process may involve aligning the chairs side by side and using a combination of upper body strength and assistance from caregivers to facilitate the transfer. It's important to note that transferring a paraplegic individual requires proper training, caution, and attention to their individual needs and abilities. It's advisable to consult with healthcare professionals, such as physical or occupational therapists, who can provide specific guidance based on the individual's condition and capabilities. Fine, for the current video, we finished that. If you want to know more about their full story, please subscribe and like this channel. If you have suggestions and input, please comment below. Thank you for watching.